So, how can you tell whether you're overweight or obese? As a medical doctor, many patients I see on a regular basis, they are often overweight and even obese. What is most shocking though is that you find they're not aware, and subsequently they're not aware of the health implication that comes with being overweight and obese. In this video, I'm going to show you the techniques and the tools that we use as medical doctors to be able to classify you into these categories, whether overweight or obese. And at the end of the video, I would have given you some tools and the thing that you can do yourself at home and be able to classify yourself into these categories. So let's dive in right now. I'm Dr. Mura, a certified lifestyle medicine physician and the founder of Dr. Mura Health. Dr. Mura Health is a company that specializes in helping people in how to prevent, treat, and even reverse lifestyle-related chronic diseases with evidence-based lifestyle medicine. According to the 2015 Global Burden of Disease study, the impact of overweight and obesity remained very high and contributed up to 4 million deaths in 2015. At the same time, in 2015, here in South Africa, the National Department of Health published a document entitled Strategy for Prevention and Control of Obesity in South Africa. In that document, as the former Minister of Health, Dr. Ernest puts it, we have set ourselves such an ambitious target of decreasing obesity prevalence by 10% by 2020. Now, as we end 2020, have those goals been able to be realized? I don't think so. The situation is rather getting worse. Just from 2019, we know from discovered statistics that nearly 70% of South African women and 31% of South African men are overweight or obese. Not only that, the young children, the 13% of South African children are overweight. And that is more than double the global average of 5%. So what does it mean to be overweight or obese? Now, overweight simply means that you have too much body fat, while obesity means that you have way too much body fat. Now, the body mass index, or BMI, is generally used to indicate the different ranges related to health risks. Now, the body mass index of less than 18.5, that classifies you as underweight. The body mass index of between 18.5 and 24.9, that classifies as normal body weight or ideal body weight. Now, the BMI or body mass index of 25 to 29.9, that puts you in a bracket of overweight, while the BMI of 30 or more classifies you as obese. The obesity is further classified into 3 classes. Class 1 obesity, body mass index of 30 up to less than 35. And class 2 obesity is a body mass index of 35 up to less than 40, while class 3 obesity is a body mass index of 40 or more. This class 3 is also often classified as a severe obesity or extreme obesity. Now, it's easy to work out what is your body mass index if you know your height and your weight. What you just need a calculator, and then you can be able to do it. And there are even so many other apps that one can use to do that. So what you do is, so the body mass index equals your weight in a kilogram divided by your height in meters squared. For example, if you weigh 80 kilograms and your height is 1.75 meters, what you have to do, you have 80 kilograms and you divide into 1.75 times 1.75, and that will give you a body mass index of 26, which puts you in the bracket of overweight. The body mass index, however, has some limitation. Yes, it does take into account of your height, but doesn't take into account the composition of your weight. Bodybuilders, for example, they can be heavier for their height, but they can also be extremely lean. So the body mass index can overestimate the body fat. The body mass index can equally underestimate the body fat in patients that have lost muscle mass, especially the elderly. So because of this, you may find that to only use body mass index, you may miss out some patient. For example, according to body mass index, someone who have a central obesity, someone who has visceral obesity or the too much fat around the abdomen, maybe according to the person's height, may still be classified as normal. But when you check it, the one who's heavy, this person with a central obesity may have up to twice risk of dying than someone who's overweight or obese, according to BMI, but who doesn't have a central obesity. Now, because of this, we have to use another way, not only body mass index. By the way, if you're still watching and you're getting value from what we're talking about, please press the like button and also subscribe to this channel so that you won't miss any of the health topic that we're going to be bringing to you. So, other way to do this, you need to check the waist circumference. But having said that, before we go to the waist circumference, the idea or the gold standard measure of obesity is what is called the body percentage of fat. Okay, body percentage of fat. That is basically when you use that tool. The problem is this can the calculations can be a bit can be complicated and also maybe expensive. But using the body percentage of fat, you're going to find that obesity is classified if the percent of body fat is over 25% in men or 35% in women. All right. So now, because of these limitations of body mass index, the World Health Organization and other health institutions recommends that one uses both body mass index and waist circumference. Now, the waist circumference also is very easy to measure that. Just from the top of your hip bone and the lower part of your rib, just breathe out normal. And then just take a tape measure around and just measure the centimeters by your umbilicus. And how do you interpret this? It's very simple. The risk of metabolic complications starts with waist circumference of 80 centimeters in women and 94 centimeters in men. But the severe metabolic complications start when women have a waist circumference of 88 and men have a waist circumference of 102. But having said that, it's not only about the body fat. That's why waist circumference is very, very important. The location is also very important, like I just mentioned, because the abdominal obesity, yes, we know the normal fat that you have, the pinchable fat around your body. But the dangerous one is the visceral one, the one that goes around and infiltrates your internal organs, bulging out your belly. That's the dangerous one. That's why we need to use both the body mass index and the waist circumference. Even better, there is another way to knowing if that you have normal body fat, or rather central body obesity, is that you take your height. It's a waist to height ratio. So your waist to height ratio should be less than 0.5. That is, make sure your waist circumference is less than half of your height. So these are the measure tools that we use, and the combination of this actually gives you a good idea, and you don't miss any extra fat that it may not be accounted for. Yes, the body mass index is good, we use it, but now combined with the waist circumference, and even better to do the waist to height ratio. So for all the children 6 years and more and adults, the waist to height ratio should be less than 0.5. All right. So again, if you forget to like, please press that like button and also subscribe to this channel. Next, we're going to be talking about what is the health implication of having that extra weight. I mean, we talked about how 4 million deaths every year dying due to overweight and obesity. So we need to look into that and see what we can start doing. That will be up next. Thank you.